Hello and welcome to the EDU-TALK Author Series, hosted by Biotone Edu Partner Program, and massage industry authors. The EDU-TALK Author Series is a bonus extension of EDU-TALK Tuesdays to further support virtual learning and building massage community by connecting you with industry authors who, through their books and textbooks, support your career success. Today's author is Dr. Susan Salvo. With over 40 years as a practicing massage therapist, she's an educator, industry presenter, and reviews case reports for the Massage Therapy Foundation. Additionally, she's participated in Massage Therapy Body of Knowledge Project and Council of State Governments Interstate Compact. Her blog is Susan Salvo's Massage Passport, Massage Practitioner's Guide to Pathology, Special Populations, Self-Care, and Improved Professional Practice. Let's listen and learn as Susan shares the inspiration, insight, tools, and tips from her textbook, Massage Therapy Principles and Practices, which was released this year and is now in its 7th edition. Welcome, Susan. Thank you for joining us. I'm going to turn the screen over to you, and I will come back at the end of your book review. Thank you.
Thank you so much. And thank you, Biotone, for allowing authors to come and share the background and inspiration behind their textbooks. So what I'm going to do is I'm going to do a share screen, and I am going to talk a little bit about the textbook. So view slideshow from beginning. Okay, can you see the textbook?
Yes.
Great. Okay, so I have written 2 textbooks, and again, my name is Susan Salvo, and this is the textbook that was just released recently, Massage Therapy Principles of Practice. And I like to tell backstories behind stuff. So one of the things that I like to do before I make a decision about something is I do a lot of crowdsourcing. And so I took this image, and I wanted to be very inclusive and represent a lot of nationalities and practice settings. So I put this one on the Facebook, and I usually do everything about 3 days. So I got this one, and so far this was the book the book cover that was decided on. But one person said they didn't like the bottom picture with the chair massage because it looked like their face was in a bunch of balls. So that was kind of funny. But then the fun one happened. The fun one happened, which was someone said the very last possible minute before I made a decision that the client on pregnancy massage was laying on the wrong side. It was laying on the right side and not the left side. So I was like, thank you. My God, it takes a village. So I had my editor flip the image, was it vertically 180 degrees, and get it on the right side. So I'm very grateful, whoever you are on Facebook, to share that information with me. So again, so then I guess that's probably one of the things that I do. I don't see through a microscope. I open up and I let a lot of people's voice come through when I prepare materials for the profession. So you did a great job introducing me. Oh my God, I think you hit almost everything on this list. Massage therapist of over 40 years. I did get a doctorate late in my career. It's kind of funny. I do everything backwards sometimes. So I became a massage therapist, and then started becoming an educator. And then I decided to be fair to myself and to my profession. Then I got an education degree. Bachelor's was first. Then a few years later, I went back and got a master's degree in education leadership and instructional technology. This is about 2012, about when the whole online education thing was really, really hitting the ground. And so I was able to really add that level of expertise to the online resources, the textbooks. And just to let you know, when a textbook title is doing well, it's kind of like, is the permission to redo it, to have another edition. And the author is expected to have a new edition about every 4 years. So you can kind of see, if it's the 7th edition, you can see I've been writing about 30 years. And so then I finished my degree, and then I wanted to get a doctorate. And I was already in my 50s. So, but what the nice thing about getting a doctorate degree is I really do understand research from a level probably unlike any other massage textbook author of entry-level textbooks. And at this point, the focus in education it's still online education, but the focus was multicultural. So this is probably one of the biggest strengths, and you'll see this when I start talking about the textbooks that I have, is the whole level of inclusivity, diversity, and cultural competencies. That was a big focus when I was in school, and looking at things from multiple perspectives. So we talk about empathy in a few minutes, you'll see where that comes from. I am board certified. I do believe in board certification, as you will find out as I talk about the inspiration of the textbooks. I really look and see what other professions are doing and make sure that we as a massage profession are in line with those options and attitudes and advancements. And board certification is almost in every other profession except ours. So I think it's been one of the most visionary things we've ever done. So I really do believe and support the concept of board certification. But look at the bullet that says I'm an educator in several schools. This is kind of interesting. So I teach at a massage school in Louisiana. There's one school I teach at that is a 500-hour program, and one school I teach at that's a 900-hour program. And then I teach at the school in New Mexico, and that's a 650-hour program. So I'm kind of in the trenches on many different levels. So I have the perspective of understanding it from multiple perspectives, from the privately owned school to the more corporate structure, Title IV school, and with multiple programs, not just massage therapy. So I do bring that expertise to the table. I am a perpetual student. So I think that's one thing, talking about the concept of empathy, is I'm always looking at material from the student's perspective. In fact, even though I finished my doctorate degree, I went back to school and I'm studying psychology. I just finished a course on Sherlock Holmes, very, very fun. So I'm doing some literature, and this semester I'm doing a course on Irish folklore. I know how much you love Ireland. And next semester I'm already doing a history of jazz. So again, and the big thing in education right now is called intradisciplinary education. And I do believe in that concept. And so it's not just I'm focusing just on massage therapy or education. I widen my viewpoint so I can pull in those other nuggets from other viewpoints and bring it into the textbook in the way that I present material. I also been a yoga enthusiast. I've been practicing yoga for about 7 years. I did very dedicated practice. And look at the second to last bullet. I also am a frequent expert in legal cases that involve massage therapy. I work on the plaintiff side, I work on the defense side, but I'm able to look at massage therapy through a legal lens. And because of my writing expertise, I know how to write. I'm often asked to opine. That's the term that they use in legal cases, to opine upon legal cases. So again, I'm able to bring that level of expertise into the textbooks. Right now, working on 3 cases. So what is the inspiration? Why am I doing this? There's 3 main reasons. Number 1 is integrity. I think that if we are going to move the profession forward, that's one thing that's going to be expected of us, is we have to demonstrate not only in who we are, but how we educate our professions, and the educational materials is a lot of integrity. So once you look at the first bullet, it says consistency across professions. It became real apparent to me early in my writing career that some of the stuff that we were saying in our textbooks were not what they were saying in PT textbooks or esthetician textbooks or psychology textbooks. So I made sure that whatever's in my textbooks has been vetted. Now, how do I do that? If you look at the next 2 bullets, you'll see reviewed by allied professionals and blinded reviews. So this is one way to attain integrity. So what I do is, like when I finish a chapter on, let's say, dermatologic pathologies, or pregnancy massage, it matters not. What I do is I give it back to my editor, and she has it reviewed, or he has it reviewed by with 3 professionals. So I want a massage therapist to review it to get that lens. I want a massage educator to review it to get that lens, but I also want, it's called an external audit and research. I want someone outside of my circle to review it to show me any blind spots. So the pregnancy massage would have a OBGYN look at it, or a nurse practitioner that specializes in midwifery look at it, or the pharmacology chapter would have a pharmacist look at it. The dermatologic chapter would have a dermatologist look on it. So basically, we're bringing those professionals to our table and saying, we have a wonderful profession here. We want you to inform our materials, but it also shows them that we do care about our educational material. So we're sitting at their table, but also they're sitting at our table, informing our practice. And when I say blinded reviews, is I know that I'm going to be biased to the higher level professional. So what I do is, when it's called single blind, when double blind would mean they don't know who I am and I don't know who they are. But in this case, they know who the author is. But when it comes back, it doesn't say this is the massage therapist, this is the instructor, or this is the dermatologist. It comes back reviewer A, reviewer B, reviewer C, because what they say should matter, not who said it. So it's a way to create a more, again, more integrity to the textbook, and for everyone to have an equal voice, and a voice, but an equal voice in that process. So why do we do that? The whole purpose of being a blinded review and external audit and member checks is for integrity and unbiased. And this is the thing in our profession. When I listen to other professionals, we tend to be extremely biased, and I'm aware of my bias. So I try to, it's called Epige, I put that on a shelf. And when I'm writing a textbook, I'm saying, I know I'm biased, but I'm going to suspend that biased belief and look and create the most honest, high quality, integrity information that I can. And so obviously I'm doing a lot of myth busting, and we make a lot of mistakes on how we approach information without evidence base and without checking with other professionals. A great example is blood thinners, or somebody being on painkillers. The way we talk about in this profession is largely wrong. So in my textbook, I not only tell you why it's wrong, but I give you research studies that say why it's wrong. Or not to massage someone who has DVT. That, and again, another really strange thing that we've done in this profession, that I'm able to take a very evidence-based approach on it and talk about the studies that were used to bust the myth. Or of course, first trimester pregnancy, a lot of that. But I even take a evidence-based approach to things like body mechanics. What is it really? And when we get injured, why is it happening? And there's a lot of great studies, including a recent job task analysis done by the Massage Therapy Foundation, that information is in the textbooks. So, and can a pregnant woman get a hot tub treatment? Or what about CBD oils and essential oils? So all this stuff is in the textbook, talking about it from a very evidence-based, practical, which is the next bullet, practical standpoint. We also talk in the profession a lot about things like endangerment sites, but again, how much of it is really based on evidence, and what injuries can happen when you do massage into certain endangerment sites. And again, I'm able to talk about it from a case report standpoint, but also from a legal expert standpoint. And look at the adverse events. We don't talk enough about adverse events in this profession. And again, if we're going to gain the respect of other professionals, medical professionals, healthcare professionals, we need to be able to talk about adverse events and change our practice to avoid them so we can protect the public. So the practicality is, because of the integrity, therapists need good information they can trust. Again, trustworthiness, going back to integrity, good information that they can trust when they're making decisions. So it needs to be a very practical manual. And the third thing, it kind of Venn diagram with practicality, it has to be something that majority of people can read and understand. About 10 years ago, there was this big push in healthcare called health literacy. And basically it was a way to write and explain things that reduce reading barriers. I am a person myself who is dyslexic, and I have what's called a print disability. So even though I write textbooks, I struggle with reading. In fact, the courses I'm taking right now, the Sherlock Holmes course and the Irish folklore course, because of my reading barrier, I'm doing audiobooks. So I'm able to get the information acknowledging my reading barrier. And the latest research study says between 10 and 20% of the people reading, including students, are going to struggle with reading. So what I do is, because I'm an educator, I know how to write to a lower reading level. And by the way, during COVID, the reading level dropped 1 grade level. So now we're dealing with people in our classrooms who have a less reading literacy than they did a few years ago. So, and how do I do that is in education. And I know that software programs have the readability built into the word programming, but before computers, what we did was we took a 100-word passage, and then we counted the number of syllables and we counted the number of sentences. And then you plotted it on a chart, and that determined the readability score. When I first started writing textbooks, the other textbooks that were out there, of course, I had to do my research. I wanted to know what the competition was doing. The other textbooks were clocking out at a 17 grade level, which is actually master's level. So you can just see how we got these materials that are for master's level students in college, but most of our students in our classrooms are not. They're high school level. So I was very, very cognizant, very mindful of this whenever I was writing. So I do a lot of sentences, and I choose words. And this is not dumbing down the information. I want to make this very, very clear. In fact, I had one professor say, if you can't explain it simply, you don't understand the concept. So that is what I do. I explain complex concepts using simple terms. Great example is the word ascertain. I love the word ascertain, but it's not necessarily the best word to use in a textbook. So I will choose another word instead of that to mean the same thing, but to reduce reading barriers. And you can see under readability, a writing style that reduces reading barriers. I know how to do it, and I do it consciously. And it's also called the parsimonious principle. And another word to describe parsimonious is it's a lean type of writing. When I show you some pages, I'll point those things out. And going back to my understanding of text to speech, the ebook has the ability to go to text to speech, and not only in the English language, but add other languages as well. So for me, the inspiration, I wanted to create textbooks that had a lot of integrity, that had a lot of practicality, and a good level of readability. So that is my inspiration. So a couple of highlights of my textbooks is we went to, because of the inclusion principle, we went to non-binary gender neutral terms. So in the textbook, you will not see he and she, you will see they. I expanded the LGBTQ+ section in the cultural competency section. This is chapter 2. And in the body mechanics section, draping, we use a gender neutral draping. So again, very, very strong message of inclusivity. And I'll tell you what else I did. So going back to the concept of reviewers, not only did I want members of the LGBTQ+ community to review the book and make sure I wasn't missing anything, I also went across the pond. I also went to England and France and Italy and got members of LGBTQ+ in those communities to also review it. So it's not just one particular population, it's also geographic competent. So I thought that was really kind of fun. And I again, great insights. I love making sure it's a textbook of many voices, not just mine. So I do talk a lot more about CBD products. Obviously, it's becoming part of our culture, part of our massage culture. And yes, we do have a massage culture. And the consumption of alcohol. Again, this is another thing that we get wrong. Oftentimes, I use an evidence-based approach to talk about if a person has consumed alcohol, what are some best practices surrounding that? Because there's becoming so much more research on the nervous system and the endocrine system, I added a section in the benefits of massage that focuses just on the neurophysiology. So that's kind of fun. So you do have that science piece, but we still have the readability and the practicality. And I want you to notice the next bullet that says empathy-based ethics. I ran across this wonderful researcher, Dr. Helen Reese in Harvard University, and she started doing empathy training on physicians. And she wanted it to be nonverbal, to transcend language barriers. And I loved it. In fact, I took education under her so I could really, really get a solid understanding. And a lot of that, and I do credit her for this in chapter 2 and chapter 7, a lot of that goes into the textbook. So we really teach students how to express empathy non-verbally. And it's very, very simple how to do that. I've already talked about the emphasis on side effects and adverse events. This should be in every single intake form that we have in our profession, and it starts in entry level. And there's a whole section on pressure. So I know we talk a lot about pressure and its effects, and deep tissue versus lighter pressure. But how do you gauge that? Is it objective? Is it subjective? Can we use numeric? Can we use descriptive? Can we use analog? I mean, what are the different scales? And I talk about those different scales in the textbook and how to use them. And there is a section on emergency preparedness. I know that Biotone's about to do a new series on diabetes. And so the emergency preparedness talks about things like choking. And yes, you can choke on mints when you're in the supine position. We talk about choking. We talk about strokes. We talk about heart attacks. And we talk about hypoglycemic episodes, what to do, again, evidence-based, what to do if your client has a hypoglycemic episode. Because as you know, and you will find out if you continue with the diabetes series of Biotone, that the incidence rates are going up, not down. So this is just a real quick overview of principles in practice. There are 2 units and there are 30 chapters. So again, if you have a school, you don't have to buy separate textbooks for everything. In fact, the big trend right now is instead of having a book for a 40-hour unit, have a well-written chapter. So that is what I bring to you. It's pretty much everything in one book. So it goes from the history to therapeutic relationships. There's the cultural competencies, tools of the trade, career longevity. Again, self-care really is talked about in this profession in the context of career longevity and injury prevention. So I'll go into that using an evidence-based approach. And notice too, Michelle Renee. So I pulled in another professional. Michelle is a massage therapist, but she's also a professor and a chiropractor. And so I wanted her voice to really come through, and she did a great job with this chapter. Then the next one, evidence-informed practice and research literacy. But look at chapter 6. So I invited someone that I met when I was working on the Massage Therapy Body of Knowledge project, Joellen Shafton, who is a PhD. She's also she calls herself a warrior, but she's a veteran. So she brings a lot of the evidence-based approach to working with tactical athletes. That's the term that we're using for people in the military, people on law enforcement, and first responders, including firefighters. So that is another special populations that we pull in because of Joellen. And so she wrote that chapter. It's wonderful. Then you have body mechanics, client positioning, and draping. Chapter 8, as you can see, it is massage techniques where we include mobilizations and stretches and endangerment sites and contraindications, because it all falls within the context of massage. The next chapter is going to be on standard precautions, very important during COVID. And that's when you have the emergency preparedness piece. And then, of course, professional standards. This is all of the business stuff. That's scope of practice, standards of care, documentation, informed consent, treatment planning. And there's even a section on referrals. And this is another thing that we kind of get muddy on a lot in massage. So there's 3 standard ways that you can do that. And that's making the client the communicator. You can call the clinic, and it talks in this chapter about what to say and what not to say, and when to say it, and then writing a letter and what needs to be in that letter. So some great information, again, very practical, very bulleted step-by-step. This is what you do and why. And the why is a big thing for me as well. And then the special populations, pregnancy, and I love this one so much. With adolescents, the whole conversation is changing about informed consent and about what they should and should not wear. Should there be a parent in the room? How do we handle draping? And so all that's discussed from a very evidence-based standpoint. So that might be another topic for a future class, is working with children and adolescents. But this is when, and I also go into a lot about visual impairments, hearing impairments, and mobility impairments. One of my legal cases recently was about a woman in a wheelchair. So I'm able to write a report and pull in some of those pieces about the best practices from a massage standpoint about working with people in a wheelchair. Hydrotherapy, again, we do include spa applications here because a lot of massage therapists are getting out of massage school who are going to be working in spas. There is a section on foot reflexology. So I just want you to know, if you're thinking about using this textbook, or if you use this textbook, that even though it's very evidence-based, I still very much honor tradition and the tradition of the profession. And that is going to be strongly in chapter 13 and chapter 16. As you can see, that's going to be your Asian bodywork therapy, which includes Thai, massage, shiatsu, and Ayurvedic principles, including warm up points. I just added that one to this new textbook. But look at 14. 14 is basically your clinical massage section. And we are starting to separate the different styles of massage. So we talk about the wellness-based, self-care, spa-oriented private practice, and then the clinical, medical, orthopedic type of massage. So in there, I give you a fantastic definition. And it was even vetted with wonderful clinical practitioners such as Whitney Lowe. That piece is in there. We talk about the new theories of pain, the neuromatrix model, the biopsychosocial model, and how to do clinical assessments, because there are going to be something that you need to be familiar with. The clinical assessments is basically how to rule out things that we should not be working on, certain neurological conditions and orthopedic conditions that require a referral. All that's in there. And then the clinical application methods. I really like this section. This is on things like cupping therapy, manual lymphatic drainage, MET, PNF, strain counter strain, therapeutic taping, all the little things that scraping, iStem, all that's going to be in that chapter. And it talks about it from a historical standpoint. I love history. And then it talks about contraindications. And then it talks about protocols. And everything has a protocol except manual lymphatic drainage, because when you look at the main schools of thought, they're not consistent. So I acknowledge that in the chapter. And I give you some similarities, but I also say that you need to go for those particular protocols, you need to go to the different systems. So again, I wrote this with Michelle because she is the clinical expert. So she helped me a lot with this particular chapter. There's on seated massage, this is massage in a seated position. So people call it chair massage, but you're not massaging the chair, ha ha. And then the business practices, getting started, marketing, professional development, and accounting and planning. So this is unit 1, it's all about massage and professional practice. Now, I had to do a weird screenshot on this one because it overlapped 2 pages, but the APK in pathology is 18 through 30. You can see all the major body systems are here, from skeletal system, cardiovascular system, respiratory system. But look at kinesiology. This is another one. It's almost 200 pages. So we went a lot into this one, and I separated into lessons. So there's 12 lessons. It goes from the first 3 lessons, which is going to be muscles and bones and joints, bony landmarks, to the muscles. And I classify them into what they move: muscles that move the neck and the head, face, shoulder, elbow, hand and wrist, fingers, and just on and on. So it's very organized well. So again, 2 units, only really need 1 textbook. Overall, I spend a lot of time on vocabulary, including the etymology, the word roots. So what does meta mean? What does para mean? What does dactyl mean? What does syn mean? What does athro mean? What does osteo mean? What does myo mean? So I talk about that from a Latin and Greek standpoint. And we even do a lot of word games on Evolve, which is going to be the section, you can see that in the second to last bullet on Evolve. Evolve is the online companion to all Elsevier titles, not just mine. And we talk a lot about, if you've never seen a word before, can you guess what it is? A great example is cervicogenic. So I talk about what is a cervicogenic headache. If you know that cervix means neck and genic means to produce or to create, you'll put those 2 words together and you'll know that a cervicogenic headache means a headache that basically begins in the neck. So we talk a lot about word roots. There's great end of the chapter assessments. I do a lot with bulleted lists, going back to the whole concept of readability. I talk about learning tips. These are also called mnemonic devices. that are sprinkled throughout the textbook. Now, there is research sections in the book and on Evolve. And look at the next one. Every chapter has a biography. And I love this. When I was going through massage school, when I was going through college in my psychology books, every chapter had some person that they talked about, the background of this person. And I liked it because it showed me who helped shape the profession and kind of gave me more empathy and understanding and appreciation of the shoulders of the giants I was standing on. And every edition I do a new one. So this new edition, I wanted a female and I wanted a researcher. So I chose Nikki Monk. So some of you guys may know Nikki Monk. So her bio is now in the next edition of the textbook. So that's a fun one to read, or maybe to assign some of your students, is to read about John Upledger or Paul St. John or John Barnes or Peter Ling, Ronald Melzak, who did the biopsychosocial model, and the neuromatrix model. So it's kind of fun to look at those. This talks about some of the end of the chapter assessments. So I do both the matching and the multiple choice. This just shows you the multiple choice section. And because I know education, I'm very savvy with the best practices. So the best practices is you should never have more than 12 questions. Otherwise, you get overwhelmed and it's hard to retain information. Even the matching sections, I've limited it to 12 in the word bank. So again, I utilize those best practices when I'm developing the materials. Okay, this just shows you another, not only the matching section, again, 12, you see matching 1, matching 2 on the left, but you also see I've added things like case reports, discussions, and internet assignments that you can give to your students if they need extra work, or they just want to take something further. And you can see on this page, I want you to notice it says Evolve Resources. These are all the free, and I do mean free, resources that are on the textbooks, including things like a practice exam for licensing and certification, a body spectrum electronic coloring book. Students love this. An audio glossary, and stress busting tips for massage students. I had so much fun with that one. But it talks a little bit about what's at the end of every single chapter. This is not just one chapter, this is every chapter. This talks about the bulleted lists I meant. So you can see here's one from chapter 14, which is the clinical massage chapter. It talks about the different barriers to range of motion. So I have the physiological barrier, the anatomic barrier, and the restrictive, also called the pathologic barrier. You can also see the learning tip on this side to help you remember the order of assessments are conducted, the acronym. Anyway, you can see that there. And look at the infill. And now this one has a bullet and a sub-bullet. Now, if you notice the gait phase on the other side, you can see a swing phase and a stance phase. And these are all often numbered 1 through 8. So you can see we have the bulleted list, but we also have a numbered list as well. The next section talks more about the learning tips. So we talk about abduction, and then the learning tip to distinguish it between abduction and adduction. And then we talk about how to determine ulnar deviation versus radial deviation in the terms of another learning tip. But look on the other side real quick. You can see joint play. Anytime you see a bulleted term, that's going to be in the glossary. And I often tell students when they're thinking, how do I study for the MBLEX? How do I study for licensing, state licensing exams? I say, end of the chapter questions, all those assets, all those ancillaries, and then study the glossary. Because that's going to be, if you don't understand a word on the MBLEX, you're not going to get the question right. So this is another interesting thing that we do wrong. We do a lot of SOAP notes in this profession, but no other profession does it. So it's one of those things that we've hung on to that should have been let go decades ago. And so when I went to do the assessment documentation chapter, I would go to the medical profession saying, what kind of documentation do you often use? And it's FDAR. So I do talk about SOAP, but I focus on things like FDAR. FDAR means focus. What's the purpose of the session? Data, both subjective and objective, and research data if it's available. Action, what did you do to address the client's focus? and the client's response. And one of the Biotone talks I've done was on documentation. Go check it out. It's fantastic. And also, when I believe that assessments are two parts. One's the intake, the clients fill out, and one's the interview. And we talk about an interview or a strategy or a protocol using PPOM. And all that's going to be in chapter 10. We've already talked about the referral process, so won't go into that again. But we often, and then in this chapter as well, we talk about how do you use the research into your treatment plan. So we talk about using a data table. So I'm not going to talk about that today, but it is in the chapter. And actually, it's going to be in the documentation session as well. This is what it looks like if you're curious. So you can see very easy to write. And I like this part. It's the time stamping of when did you collect this information? When did you do your post-massage assessment? The hydrotherapy session also has spa therapies, and it goes from everything from hot stone massage to flotation therapy, very popular in massage right now, to things like aqua stretch. I learned this as Watsu. Yes, I've taken Watsu training, but now we're calling it aqua stretch or aqua myofascial release. So very, very popular in spas that have access to a pool. We already talked a little bit about this. Oh, but the frailty, there is going to be a frailty scale that will help you determine if your client you're working on, whether they have a medical condition, they're pregnant, or they're elderly, or they have a disability, if they're robust or frail. And it talks about how to make that determination. This section, we've already kind of talked about the clinical massage section, but I do want to offer a little bit more about it. In this chapter, we talk about, again, another misconception we have is when can you do massage after surgery? And if you ask 10 therapists, you'll get 10 different answers. But in this chapter, it will talk very specifically when that can begin and what that should look like. And scar tissue massage. When should you start it? And we talk about the 4 stages of wound healing, and you cannot start it until they're in the remodeling phase. And in this chapter, I talk about how long that is and how to make that determination. So a lot of great information, and also soft tissue injuries. And it's changed with the whole concept of ice and movement and compressions changed. So all those new guidelines are in chapter 14. Already talked about the Eastern practices, so I'm not going to go into that. For the kinesiology section, I'd rather show you pictures. So this talks about how, again, bulleted list, talks about the learning tip. So another great feature in this book. But I bulleted the joints. So this, obviously, the clavicle has 2 joints associated with it, and it lists those in the notes section. And this section also shows you've got the bony marking, you have the significance of the bony marking, the picture, you have the label here, and then you see the view. This is superior view, and there's a little bit more information about it. So a great tool for learning your bones and your joints. Here is a little bit about the fibula. I've also added palpation information. So if this is a bony landmark or a bone or something you can palpate, it's called the surface marking. It's going to be in the notes section. So this talks about how you can palpate not only the fibular head, but also the lateral malleolus. These are some new images I added. You can see here 2 vertebrae together, and you can see the intervertebral foramen. But I particularly like this picture. This is a concept that we don't often fully understand without a good picture, is how does that rib fit on that vertebra? So you can see an attachment here on the vertebral body, and you can see an attachment here on the transverse process. So these are some of my fun pictures. I love this picture. This is one of the ones I had drawn for this edition. And so this talks about the layering of the different muscles in the lamina groove and along the back. It talks about the transversus spinalis group and the erector spinae group. So when you're pressing on these muscles, you kind of can visualize where they are. And then this, because of the level of T9, you can see a little bit of the trapezius, but also more of the lats, and there's lovely serratus posterior. So another fun picture. I'm able to use pictures from other Elsevier titles. So I really like Newman's textbook, Kinesiology textbook. So this is one of the pictures that got added to the new edition. You can also see the notes section and again, the learning tip. So very, very easy for students to learn. when they have great resources, great pictures, and condensed practical information. A little bit about the patho book. So I'm going to transition now from Principles of Practice to a pathology book. Elsevier also asked me to write a pathology book about 15 years ago. So I started in now in its 5th edition. So this came out about 2 years ago. This is the table of contents, the TOC. A couple of things now, chapter 1 and 2 are the same that's in Principles of Practice, because a lot of people use the textbook with Principles of Practice, but they may use another entry-level textbook and the pathology book on the side. So I wanted to be sure that information, that foundational information was in there. But this is really it's a couple of chapters that set this book apart from Principles of Practice. We dedicate a whole section just on pharmacology, because 70% of the American population take prescription and non-prescription medications. So that's going to be talked about. And more importantly, is going to be the routes of administration. Is it a patch? Is it a pellet? Is it an injection? So we talk about those in that chapter. Then it goes from the dermatology all the way down to all the body systems. But then we get to chapter 14. There's an entire section just on cancer as a pathology and oncology massage as a branch of massage. And again, very evidence-based, very practical. So I talk about the treatments, because most of the time you're modifying your massage according to a treatment, not for the cancer. Talks about that. I also absolutely love that I have a whole chapter just on mental disorders. Again, this is an area, if you look at some of the #1 reasons why people get a massage, it is not pain. It is to manage things like depression and anxiety. And I love this so much, this is in my textbook, the #1 type of healthcare provider that gives us the most referrals is a psychiatrist. So you can see why we need this information in our classrooms, in our students' hands. So we talk about mood disorders, mainly it's depression, anxiety, but I also talk about sleep disorders. Massage is fantastic for sleep disorders. Eating disorders, bulimia, binge eating, and anorexia, the main ones, but there are others. And then substance use, nicotine, alcohol, and then how massage can benefit or not benefit those conditions. And aging and geriatric massage is discussed next, and then hospital-based massage. Michelle did contribute this chapter. In fact, they just came out, it's amazing, with the very specific competencies for people who practice hospital-based massage therapy. So all of that is in this textbook. It's a fantastic information. I also added in the pathology book 2 main features. One is called a clinical tip, and one is called a caution box. So this is what some of the clinical tips look like. So what you see here, when you see clinical tip 11-1, it's chapter 11, the first one that's presented, okay? So this talks about working with clients who have a colostomy and ileostomy. So we've already talked about in the chapter what it is. This deserved a little bit of extra information about it. The clinical massage chapter 6 and 5 talks some of the orthopedic tests. I've added those too, even though they are in Principles of Practice, they're also in the pathology book. In chapter 10, which is respiratory pathologies, we talk about postural drainage and percussion and what that is and what that looks like. And then it talks, now this is a great technique that we can use with clients with conditions of respiration, is the thoracic extension stretch with a roll towel. And you can see here, there's also a figure in the textbook that talks about what are the 9 positions? Where do I place this towel? This is chapter 16, when you're working with people who are aging, some do's and don'ts. And this, I love this one, each one teach one. So teaching self-massage sometimes is a great thing, whether it's pregnancy or working with a special needs child, autism, ADHD, it talks about those situations. For the caution box, here's some examples. So caution, hypoglycemia and first aid. Again, you see some bulleted list. You see how things are popping. You see 15-15 rule for that very first one. You see allergies. There are some things we have to be concerned about, mainly product allergies. It talks about how to talk about those and how the massage should be modified. We talk about angina attacks in chapter 8, which is the cardiovascular chapter. And then on the other side of the screen, you can see seizures and first aid, and you can see the recovery position at the bottom, how to put your client into a recovery position. When I'm teaching this at the massage school, I also include a video. Again, there's a whole list of videos on Evolve as well for teachers. So you can augment your lesson, not only with the textbook and the lecture, but also with the videos. So every single pathology has a pronunciation guide. And again, I love words, etymology. It's going to include the description of what the pathology is, the causes, also called etiology, and signs and symptoms, treatments. Now, when you look at the treatments, I want you to see the next bullet. All the medications are in bold italics. So when you're looking up, again, why this is important to the profession, when you're looking it up, client comes in with Parkinson's disease, client comes in with MS, you can see what the common medications are, they're in bold italics. Then you can go to the pharmacology chapter and reference those specifically to see if you need to modify the massage. And again, practical information on how to address this condition in terms of massage modifications or massage considerations. You know, I'm going to be evidence-based. There's a big focus on research. In fact, what I did is I have, you know, massage and multiple sclerosis, need to know. This is what you have to do, easy to follow massage modifications. But then I put good to know. This is going to be the research section. And this is what I did. This is very unique in the profession. Sometimes when I would go to conferences, there'd be a medical professional there, like say a psychiatrist, talking about the benefits of massage for anxiety or depression or insomnia and or phobia. And then it would say, don't tell me that massage does this. Tell me what they did in the study to produce those results. So that is what this section has. So when I say good to know, I talk about specifically this study that produced this result. They did 5 sessions once a week. The sessions were 30 minutes or an hour. Sometimes I talked about if they use aromatherapy, what those dilutions are. Sometimes studies talk about the position of the patient or the client in the study. So all those details, the recipe is in this textbook. It's also in my blog. But again, this kind of shows you how, what's that going to look like? So you see here, I want to talk about the headaches first. Massage and headaches, need to know. This particular one, we talk about the SNOOP. That's something that is very important to know when you should not be massaging someone. And then I separate massage for tension headaches versus massage for migraine and cluster headaches, because they're approached differently, the different kinds of headaches. Then massage and tension headaches, good to know. This is the research stuff. So if you're using the ebook, you can see the study and you can click on it and it goes right to the section in the reference part that tells you, so you can look this stuff up yourself. And I try to group it according to like types and modalities. Sometimes it's reflexology, sometimes it's myofascial release. In this particular section on headaches, Traeger was one of the things that they used. So we talked about that. So on this next section, again, autism, you can see massage and autism, need to know, and it talks about it. And if there's a study that's specifically about massage in terms of a practice standard, I list that research here. Again, you can see very evidence-based, very research approached. And then research, good to know. This is the extra stuff. So if you're in a massage program, you have 500, 600 hours, you may not have time to go into the research sections. But if you have a longer program, you're able to take the deeper dive. And so this is why I wanted to be sure you had it. And so you can use this information to inform your practice. We've already talked about the additional chapters in the TOC, so I'm not going to go over those again. But I do want to say that in the mental disorder chapter, we talk about suicide prevention. And there's this new thing going on in the profession called the QPR method. And it's basically like CPR for heart attack. So I've taken the training and I go into what it means. So it's a very simple thing that we're recommending for suicide prevention for people who have suicidal ideations. And this in the textbook, it talks about what they are. So why is this book important to the profession? Mainly because I know how to write, I know how to put together information that has a lot of integrity, has a lot of practicality, and is accessible or readable to people. I do incorporate things like critical thinking and clinical reasoning, because I want you to know the why we avoid this area, why we ask this question. So I draw clear connections between a client's signs and symptoms and the treatment modifications. And because pathology is so complex, it's logically organized. You saw the little blocks of color. It's condensed. I don't spend a lot of time talking about pathology when the massage considerations are the most important thing, and it's user-friendly. So my dear, I am done. Tell me your thoughts.
Well, those were so thorough and so packed with information. And I'm not a massage therapist, but when I see the amount of work you've put into this and the different ways to approach it, with the need to know and good to know, throughout the book referencing the diagrams. I mean, I feel like in school I could have benefited from books that were this well connected with this is happening here, this is underlying, by the way, this is good to know. So it's a very excellent way to present the teachings and what students need to know. I also felt along the way that this isn't just a textbook for in school. This is a reference to take with you through your career. And I forgot, kinesiology, but I know there's, Susan's book had a great chapter, and what did she say, on the need to know, and to go back and reference it. Or I have a client who, I also think that it's really addressing our current times in not only understanding the drugs that the pharmaceutical drugs that your clients are on, understanding, is it the first trimester? Are you diabetic? And the other health concerns. It sounds like the chapter with autism as well, or, working with autistic clients. You just, from my perspective, you go in for a massage. You don't realize really the depth that therapists have to learn and absorb and incorporate into their practice, which now leads me to the empathy part of it, which is understanding who just walked in the door and what are they carrying with them. And, what might I trigger? What might I not trigger? All of that is much more a scope of practice than I ever imagined. And your books look like they thoroughly address everything a therapist might need to know. I wanted to ask, are these only in print, or are they audio books or ebooks?
Yeah, both. They're in print, but they're also in the audio version when you get the ebook. When you go to the navigation screen, there's a button that you push called Start Reading, and it starts reading to you, and you can change the language, and it's just amazing. And again, that's one of the nice things is Elsevier is actually an international medical publisher. So we have the authors, including Sandy Fritz, has access to so many more resources than a small publisher. So I'm really blessed. They're out of the Netherlands, by the way. So,
Okay.
but it's a great resource to have, all of the online and the text-to-speech, which is part of the online.
So as someone, as the therapist, the student is reading the book and they come to the figure, and they can scroll over that, and does that take them digitally right to that image?
Yeah, it's kind of funny. And you'll see this on your own screen. If it's an arrow, it's just, you're just scrolling over it. But if the arrow changes to a finger, then it's called a hot link.
Oh,
Then you
yes.
click on it. So if you see a finger, the pointer finger, that's a clickable link. But most of it is yes. Most of it is you can navigate to and from different aspects of the book with that feature. And you can, again, change the size of the font. A lot of people like the ebooks, but most people like the paper. But it's a whole other conversation about education. But
Right.
the ebook is available for those who need that extra resource.
I'm still the paper. I'm
Yeah.
lugging my big heavy book with me. So
Yeah. This is
yes. That how many pages is that?
wow. This one got bigger, but also the pages got thicker. This is about 800 pages. But again, one textbook, you don't need to buy 5. So in a way,
Right.
it's condensed. And again, and it's meant to be practical.
Wonderful. And the Evolve, would you just talk a little bit more about the Evolve resources? You said they were free to anyone.
Right.
They can just go to the Elsevier site.
But usually when you get the textbook, there's a little scratch off thing right here. And there's a code. And you type in the code and you have access to games. We do a lot with gamification, very popular right now in online education. You've got glossary, audio glossary, you've got flashcards, you've got a coloring book. And also, like with chapter 10, I've got like a dozen downloadable PDFs of intake forms. The one that I use, but also you may not like it. So I'm giving you others. So all of that's on Evolve. And there's videos on Evolve. There's just, it really is meant to be a companion, a digital companion to the paper book.
Now, you just sparked a thought. On the intake form, is there also an area to assess the emotional well-being of the person, the empathetic observation? Is there a place for that on the intake forms?
There is not on the intake forms, but there is in the treatment plan. And I just added it's called quality of life assessment. It's kind of what you're talking about.
Okay.
So what is their mental and physical quality of life? So that is in the textbook, but you're only going to do that probably if you're working in the clinical setting.
Okay.
Where they're looking at those kind of things. Probably not going to see that in a spa setting. They're there for other reasons. So, but yes, it's there.
All right. Well, amazing review of your books. And would you do me a favor and hold them both up again?
Gosh, okay.
Build up those muscles. Okay, Mosby's Pathology, and that's in its 5th edition. And the Massage Therapy Principles and Practices is now in the 7th edition, which was released this year. That's great. And lastly, where would people go to buy them?
The easiest place is Amazon.
Is Amazon.
Yes. So get the books, used books, audio books, Kindle versions, new, and enjoy. And again, don't forget about the blog, because a lot of this information, I wanted to make it accessible for anyone, even people who couldn't afford it. So again, breaking down barriers is all what I'm all about.
Right.
And a lot of this information is free on my blog, which is called Massage Passport.
That's right. Massage Passport, and it's the Massage Practitioner's Guide to Pathology, Special Populations, Self-Care, and improved professional practice. Well, you're like the one-stop shop. Yeah, you're covering it all and then extending it further through your blog. So thank you so much, Susan, for sharing these in-depth reviews of both your books and where to find them, which is Amazon, and it's lifelong learning. It just, you pick it up as a student and you take it with you through your full career. So thank you very much. And is there anything you'd like to say in closing?
I'm just very grateful that you're here to support individuals, to support the profession, to support the professional practice. And I'm just, I love your idea. Tell them your idea about the videos and reports. I love that.
Well, I will share, and if I'm following you on this, that the EDU-TALK series has over 3 years of recorded EDU-TALKs with industry experts. And if you are ever listening to a recorded EDU-TALK and see that there's a handout or hear myself or the speaker refer to a handout, please contact me at D Curley, and the spelling of my last name is on the screen, dcurley@biotone.com, and I will email you the presenter's handout for that. Additionally, we have launched a new series called the EDU-TALK Diabetes Series. And in fact, come July 18th, we will have Adrian Asta, the Massage Therapy Foundation president, presenting on evidence-based research supports massage therapy for diabetic health. So that will be a fascinating one to listen to as well. And thank you, Susan, for bringing that up. And Susan was one of our first early presenters when the EDU-TALK series launched in 2020. And her talk on documentation is in the EDU-TALK library on biotone.com. Thank you so much. We'll wrap it up. And I so appreciate the work you have done and all your contributions to the massage profession, Susan. Thank you.
Thank you, and have a great day.
Okay, you too. Take care.